fluid and electrolyte balance. ठीक है, so this question fluid and electrolyte things you have also studied in your generally surgery topic है ना, वहाँ पे हम बहुत डिटेल में पढ़ते हैं fluid and electrolyte के बारे में. then we have covered it in our medicine topic also, and now it's for the pediatrics turn. ठीक है, so in the pediatrics the fluid and electrolyte balance topic will be starting. So look, the 167 number question, it is stating a 2-year-old child is brought to the clinic with feeble pulse. The first buzzword you must remember, feeble pulse and obtundation. Next is on examination he has severe acute malnutrition. So severe SAM का case है, severe acute malnutrition. What would be the choice of resuscitation for this patient? So in this patient, what would be the choice of resuscitation? Severe acute malnutrition का case है. So the best option here is ringer lactate with 5% dextrose. Look, ringer lactate is the fluid of choice for severe dehydration. The same is here also. अगर severe dehydration में if they will give some other buzzwords, if the question has been changed, they will tell that the child is not able to drink, और वो generally खाने के लिए और पीने के लिए generally नहीं मान रहा है. अगर generally child, अगर if someone is presenting to you with generally moderate dehydration or generally mild dehydration, then he will be generally able to eat and drink, है ना. He will be thirsty and he will if you show him water, he will try to take water, grab water from you, and then he will try to drink. That is generally the very mild case or moderate case. But here they are already telling you that it is a severe acute malnutrition, so that is severe dehydration is there. यहाँ पे अगर generally severe dehydration नहीं दिया होता, and they could have mentioned that the child is not generally trying to take the water if you show him. ठीक है, so generally that would be the case of generally the severe dehydration. यहाँ पे देखो dextrose के केस में, so generally dextrose is to treat the hypoglycemia. Generally for the hypoglycemia thing we will use dextrose, but ringer lactate is the fluid of choice for generally the fluid of choice for severe dehydration. Let's move ahead. Next is generally, so that's why to treat both, this is the case of severe acute generally malnutrition plus यहाँ पे क्या severe dehydration भी है, so we'll use both the combination of ringer lactate plus 5% dextrose. And this dextrose you have to remember that it is just given for generally treating the hypoglycemia that is caused in generally the SAM. A child with diarrhea was eager to drink. The question has come here. Look, a child with a diarrhea was eager to drink. If he or she, the child was eager to drink, that means there is only mild generally dehydration, means some dehydration is there. ठीक है, and the skin pinch went back slowly. The child is classified in which of the categories as per IMNCI? So look, there are three categories as per IMNCI. So there are three categories is nothing but no dehydration, some dehydration, and severe dehydration. Three categories: no dehydration, some dehydration, and severe dehydration. So generally, if we see, if child has no other severe classification, give fluid or severe dehydration. Plan C, ये आप जा सकते हो generally severe dehydration में. This is the treatment. If child also has another severe classification, refer urgently to hospital with mother giving frequent sips of ORS on the way. Advise the mother to continue breastfeeding. If the child is 2 years or older and there is cholera in your area, give antibiotic for cholera. So this is the treatment for severe dehydration. नेक्स्ट इज सम डिहाइड्रेशन. ठीक है, ये देखो अनएबल टू ड्रिंक और ड्रिंकिंग वेरी स्लोली है ना, वो जनरली ही विल नॉट बी एबल टू ड्रिंक, ही विल बी जनरली प्रेजेंटिंग इन अनकॉन्शियस स्टेट. सो दिस ऑल आर शोइंग जनरली द स्किन पिंच गोज बैक वेरी स्लोली. दिस ऑल आर गोइंग थ्रू गोइंग टुवर्ड्स योर सीवियर डिहाइड्रेशन. दिस आर द बज वर्ड्स. ठीक है, इरिटेबल है ना, ईगरली थ्रस्टी एंड पिंच गोज बैक स्लोली. सो दिस इज जनरली सम डिहाइड्रेशन. सो द क्वेश्चन दैट वी हैड वाज ऑफ जनरली सम डिहाइड्रेशन. इनफ साइंस टू क्लासिफाई एज जनरली no enough signs to classify as generally severe dehydration. That will be the case of generally no dehydration. So look, in the some dehydration case, give fluid, zinc supplements and food for some dehydration. That is plan B you will be using. Plan C you will be using for severe generally dehydration. If child also has a severe classification, refer urgently to hospital with mother giving frequent sips of ORS on the way. Advise the mother to continue generally breastfeeding. Advise mother when to return immediately. Follow up in 5 days if not improving, and if confirmed symptomatic HIV, follow up in 2 days if not improving. Next is, if there is no dehydration, then the management will be generally give fluid, zinc supplements and food to treat diarrhea at home. That is plan A. Plan A will be at home and plan B and C will be generally at the hospital. So look, advise mother when to return immediately. Follow up in 5 days if not improving. If confirmed symptomatic HIV, follow up in 2 days if not improving. So these are generally the treatment. Urgent preferred treatments are in generally bold print. ठीक है, bold print में यहाँ पे जितना भी दिया हुआ that is generally यहाँ पे जैसे देखो urgently to hospitals. These are generally for the urgent referrals. So next is a child with diarrhea. The thing is here, okay, in which of the categories as per IMNCI. So this is going towards generally the yellow category, pink, green, yellow. So this is going towards your yellow category. आगे देखते हैं चलो. This is going towards your yellow category. Next, a 2-year-old child is brought to the clinic with feeble pulses and obtundation. On examination, he has severe malnutrition as reduced from anthropometric parameters. What would be the choice of resuscitation? The same question, that is ringer lactate, the food of choice in case of generally the dehydration, and 5% dextrose generally to treat the generally hypoglycemia that occurs in severe acute malnutrition. Child presents with history of protracted vomiting. What will it cause? The protracted vomiting, it will be generally causing metabolic alkalosis plus hypokalemia. ठीक है, hypocalcemia, because protracted vomiting there will be generally a lot of acid, that is HCl, will be taken out from the body, and that will result in generally metabolic alkalosis. आगे देखो, a child is admitted with iron overload. What is the antidote? So iron overload. So this is going towards your either pharma or in FMT also we have generally discussed about this. So this is iron overload. So iron overload के लिए generally the antidote of choice is deferoxamine, that is nothing but a chelating agent. We have already talked about naloxone, acetylcysteine and ethanol. ये किसमें generally ethanol किसमें दिया जाता है? Tell me. Ethanol or fomepizole, that is generally nothing but the antidote for generally methanol poisoning. What is given in an irritable child with dehydration? The child is irritable, it means there is some amount of dehydration. ठीक है. ORS generally 75 ml per kg for generally 4 to 6 hours. Next, a 5-year-old child presents to your PHC with complaints of diarrhea and is unable to take feed or ORS. His weight is 17 kg. What is the amount of maintenance fluid required in 24 hours? So generally 5-year-old child is there. He is presenting to your PHC. Just take this point out. You are in the PHC, not in the hospital, with complaints of diarrhea and is unable to take feed or ORS. So generally in this case we'll go for generally what is the amount of maintenance fluid. So the maintenance fluid will be here, we'll need to calculate. So there, look, 0 to 10 kg body weight, that is going towards generally 100 ml per kg. If the body weight is generally 10 to 20 kg, that will be going towards 1000 plus 50 ml kg for each kg above 10 kg, and generally greater than 20 kg body weight, 1500 plus 20 ml per kg for each kg above 20 kg. So 0 to 10 kg, that is 100 ml per kg, यानी कि 100 into 10, that is 1000 ml. 10 to 20 kg में generally 50 ml per kg, that is 50 into 70, that is 350 ml, and total that is nothing but 1350 ml. So यहाँ पे देखो हमारा कितना है, 1350 ml. A 7-month-old boy was brought with a history of 18 episodes of loose stools and 2 episodes of vomiting. Loose stool plus vomiting. The child is irritable but can drink eagerly. If he is drinking eagerly, that means this falls in the some dehydration case. So here we have to give ORS only. ठीक है, ORS only. A 3-year-old child with weight of 12 kg is having loose motions. ठीक है, is thirsty, drinks eagerly. Drinks eagerly means again this is some dehydration case. Tears are absent and the skin pinch goes back slowly. Of course, what is the best treatment plan for this child? So the best treatment plan for this child will be generally ORS 100 ml per episode of loose stool. If the age is generally less than 24 months, here it is 3-year-old. If the age is generally less than 24 months, that is nothing but the 2 years, then we'll go 50 to 100 ml per episode. And generally 2 to 10 years, 100 ml to 200 ml per episode. So he is generally falling in 3 years, so we'll generally give 100 ml per episode of the loose generally a stool. And if it is greater than 10 years, then generally we'll go with another mechanisms. Next, look, severe dehydration is seen in a 2-year-old child. Amount of IV fluids to be given. What is the amount of IV fluids to be given? That is nothing but generally 30 ml per kg in generally 30 minutes. Look, I'll tell you, 176 numbers. So look, this is the generally whole treatment plan for severe dehydration. We have already talked about the different one-liners that was asked in generally severe dehydration. उसके related जितना भी था we have already done. But now let's look at the complete plan here. So look, start here. Can you give intravenous fluid immediately? If you can give, generally go for IV fluid immediately. If the child can drink, give ORS by mouth. While generally severe dehydration, the child will not be able to drink, so you have to go for IV only, and IV के लिए these are the generally references. If generally you are not able to give IV fluids immediately, then you have to generally Is IV treatment available nearby? If it is available in the nearby hospital and there the parents can reach within 30 minutes, or the child can reach with their parents in 30 minutes, so refer urgently to the hospital for IV treatment. If the child can drink, provide the mother with ORS solution and show her how to give frequent sips during the drip. We have already covered this. If in the nearby areas where the patient cannot reach by 30 minutes, if generally it is not available, then what you are going to do, look, then are you trained to use a nasogastric tube for rehydration? If you are trained, generally nasogastric अगर MBBS कोई रहेगा तो उससे जनरली हो जाएगा, but generally MBBS नहीं रहता है generally in the peripheral areas. So this is if you are trained to use a nasogastric tube for rehydration, yes, then go for generally rehydration by tube or mouth with ORS solution. Give 20 ml per kg per hour for 6 hours. Total generally 120 ml per kg में देना है. Reassess the child every 1 to 2 hours. If there is repeated vomiting or increasing abdominal distension, give the fluid more slowly. If hydration status is not improving after 3 hours, send the child for IV therapy. Next, there is after 6 hours, reassess the child, classify dehydration, then choose the appropriate plan A, B, or C to continue the treatment. That is in your hand. If no, can the child drink or not? If the child is able to drink, no. If he is not able to drink, then refer urgently to hospital for IV and G treatment. Generally note there is, if possible, observe the child at least 6 hours after dehydration to be sure the mother can maintain hydration, giving the child ORS solution by mouth. So these are generally the complete treatment plan that you need to know. So next, what is given? So 30 ml per kg in 30 minutes. Next, a 5-year generally child came with dehydration. Plan A was proposed for treatment of dehydration. How much ORS should be generally given for per loose stool? So generally हमने ऊपर ही किया हुआ था. That is generally कितना 5-year child है. So 5-year child comes in 2 to 10 years. That is generally amount of ORS to give after each loose stool is generally 100 to 200 ml, and amount of ORS to provide for use at home is generally 1000 ml per day, यानी कि 1 liter per day. So generally 100 to 200 ml will go with. 24-hour normal fluid requirement for a 1-year-old child weighing 8 kg. Weighing 8 kg is generally, so 8 kg comes under less than 10 kg, that is generally 100 ml पर केजी. सो विल गो विथ, यहाँ पे सबसे बेटर ऑप्शन क्या है हमारे पास 800 ml. ठीक है, 800 ml विल बी द बेस्ट. ठीक है, 8 into 100 दैट इज जनरली 800 ml. आगे देखो, द सोडियम कॉन्सेंट्रेशन ऑफ लो ऑस्मोलरिटी ORS इज, the sodium concentration of low osmolarity ORS. This again we have covered in our generally PSM. वहाँ पे भी पूछा जाता है लो ऑस्मोल जनरली ORS का कितना होता है. सो जनरली दिस इज नथिंग बट सोडियम विल बी 75 millimole per liter. Look here, सोडियम क्लोराइड दैट विल बी 2.6 जनरली ग्राम पर लीटर, एंड मिलीमोल में जाओगे तो जनरली दैट इज 75 मिलीमोल पर लीटर. एनहाइड्रस जनरली ग्लूकोज विल बी जनरली 75 मिलीमोल पर लीटर. पोटासियम विल बी जनरली 20 मिलीमोल पर लीटर, एंड ट्राइसोडियम साइट्रेट विल बी जनरली 10 मिलीमोल पर लीटर. These are generally the values you have to remember. Calculate the fluid requirement for severe dehydration in a 1-year-old child weighing 8 kg. वही पहले वाला क्वेश्चन, that is nothing but 800 ml. So initial fluid कितना देना है 30 ml per kg, that is going to be generally 8 kg है तो 8 into 30, that will be going to be 240 ml. That you have to give in 1 hours. And the next is remaining you will be giving in generally 70 ml per kg, that is 8 7 ja 8 into 7, that is generally 560 ml, and that will be given in next 5 hours. So this is generally the treatment plan. Intraosseous line is placed in which bone in children? So intraosseous line that will be generally placed in the sin bone. sin bone जिसको हम बोलते हैं that is nothing but टिबिया. ठीक है, टिबिया में जनरली इसको करेंगे. Look, used when venous access is not available, then only we will go for generally this intraosseous line. And low osmolar generally ORS composition. Low osmolar ORS composition is sodium 75, just अभी हमने किया 75 मिली इक्विवेलेंट, and generally 245 milli osmol. ठीक है, 245 milli osmol. This is generally going to assure low osmolar ORS composition. So this much for this video, and we will try to cover the vaccinations topic in the next video.